Have you ever been baffled by the question, what causes a positive anti-nuclear antibodies or an ANA test? You are not alone. If you clicked on this video, chances are that you are seeking for some answers. Welcome to my deep dive into the intricate world of positive ANA test. Today I will discuss what is a positive ANA test, why was this test ordered, and what are the most common conditions where I as a rheumatologist will see a positive ANA test. And I will explain to you the most common signs and symptoms of these diseases. Let's begin.
Rheumatologist.OnCall.com.
First, let's talk about what is an ANA or anti-nuclear antibody test. Anti-nuclear antibodies, in simple terms, are antibodies that have the potential to bind to certain structures within a cell. They are called antinuclear because they react with the cell's nucleus. A positive ANA test suggests that these antibodies are present in your blood, but they don't make a diagnosis. For making a diagnosis, you need an expert, a rheumatologist, that will look deeper and understand and connect the dots. Like the pieces of a puzzle, ANA is just one piece of the puzzle. Why was this test ordered? The ANA test is usually ordered by your primary care physician when they suspect an autoimmune disease. Most patients have vague or multiple symptoms like joint pain or low-grade fever or a rash that looks suspicious of an autoimmune disease. But what are autoimmune diseases? These are some conditions that are happening when your body immune system gets a little bit confused and starts attacking your own cells, tissues, and organs. In most of these diseases, the ANA is just a sign of autoimmunity that will alarm the primary care physician that you need to be evaluated further. As I have explained in my other videos about the 10 signs of autoimmune diseases and the top 10 diseases treated by a rheumatologist, not all autoimmune diseases are treated by rheumatology, but we do treat many, from rheumatoid arthritis to lupus, Sjogren's syndrome to vasculitis. So if you want to learn more about all of these diseases, check out my videos in the channel. Connective tissue diseases. So when we talk about connective tissue diseases, we are referring to those conditions like lupus, rheumatoid arthritis, Sjogren, scleroderma, and so on. But what's the common thread here? They all target the body's connective tissue, those essential fibrous material that act as the body's glue, which can hold various structures together, like your skin, your joints, your lungs, and even the heart. Let's take lupus as an example. This is an autoimmune disease that may target any part of your body, from fatigue to joint pain, rashes, sores in the mouth, hair loss, and even lung, heart, and kidney issues. The symptoms of lupus can vary a lot. And here is the fact that might surprise you. Almost every patient will show a positive ANA test. But, and this is crucial, a positive ANA test does not necessarily that you have lupus. The diagnosis is far more complex, relying on symptoms, signs, and additional testing. There are many types of specific antibodies that can give you more clues that you are dealing with lupus. If you want to learn more about these types of antibodies, watch this video in my channel where I will discuss the most common 10 types of autoantibodies that is used by rheumatologists to diagnose autoimmune diseases. Then, let's talk about Sjogren's syndrome. Think dry eyes and mouth, but it's far more than that. Sjogren's syndrome can tag along with other immune disorders like lupus and rheumatoid arthritis. But it can also be more complex than that, targeting organs like your lungs and brain. If you want to learn more about this disease, I have posted many videos in my channel. But here is another twist. Not everyone with Sjogren's will test positive for DNA, but they might for the SSA and SSB antibodies. Moving on to inflammatory myositis. Most frequently seen are polymyositis and dermatomyositis. Now picture this, inflammation targeting your muscles, which can lead to symptoms like muscle weakness and even skin rashes. Again, a positive NA test can show up, but it's usually alongside other specific types of autoantibodies. Even in these cases, the diagnosis is made by putting the pieces together, not only relying on one test, which is the positive NA. Rheumatoid arthritis patients can also have a positive NA test. However, the signs and symptoms of rheumatoid arthritis, like hand and feet pain, severe morning stiffness and swelling in the joints, and other types of autoantibodies like rheumatoid factor and anti-CCP can make the diagnosis. A positive NA test can also happen in patients that take certain medications like TNF-alpha inhibitors, such as Enbrel or Humira or Simponi. Now let's talk about thyroid. This butterfly-shaped gland in your neck plays a vital role in our body. Now, autoimmune thyroid diseases, specifically Hashimoto thyroiditis and Graves' disease, are due to inflammation that can affect this gland. What's the big deal about that? When inflammation affects your thyroid, it can make it overactive or slow it down, causing it to be underactive. Either way is not good news. Symptoms can range from weight gain to fatigue, being nervous, having palpitation, and the list can go on and on. A positive NA test is very often seen in these autoimmune thyroid diseases, which can point towards the cause of these changes in your body. So, a positive NA test can be associated with thyroid disease and not only with lupus. Liver diseases. Another common cause for a positive ANA test are liver diseases. Your liver is a vital organ responsible for detoxifying your blood. But what happens when your immune system targets the liver? Then you may develop an autoimmune disease of the liver, of course. The most common autoimmune diseases of the liver are autoimmune hepatitis and primary biliary cirrhosis or primary biliary sclerosis. Now, a positive NA test, when combined with changes in the liver enzyme, it is a red flag, as they may suggest an autoimmune disease of the liver, and that will require an urgent evaluation by a gastroenterologist. Infections. Let's talk about infections. When your body encounters a virus, a bacteria, or a parasite, the immune system reacts trying to defend you. However, some of these infections can persist in your body for many years, which can cause a prolonged stimulation of your immune system. These are called chronic infections. Let me give you some examples. Infections like mononucleosis, which are caused by Epstein-Barr virus, or infections with CMV or cytomegalovirus, are chronic infections, and most people on this planet will live with these viruses their entire life. Infections with bacteria like tuberculosis or histoplasmosis can be present for many years, and they can also activate your immune system. What do all of these chronic infections have in common? They can cause a positive NA test. So make sure you get tested for these infections if you have a positive NA test and no signs of autoimmune diseases. Cancers. Last but not least important, positive NA tests can also be seen in patients with different cancers. Why? Because cancer cells do stimulate the immune system, and the immune system tries to defeat against the cancer cells. And this can result in production of autoantibodies, including antinuclear antibodies, which can cause a positive NA test. What kind of cancers are associated with a positive NA test? Lung cancer, breast cancer, colon cancer, and different kinds of blood cancers that we also call lymphomas. Now, something interesting about that is that treatment for cancers like radiation therapy can also cause autoantibodies and can lead to a positive NA test. Radiation therapy uses high-energy particles that will destroy and damage cancer cells, but will also trigger the immune system response. The body, in its attempt to heal and repair the damage caused by the radiation, may produce autoantibodies, including ANA. This production can vary from person to person and does not necessarily mean that an autoimmune disease is present. That is all for today. If you find this video enlightening, give me the thumbs up and don't forget to subscribe. In my practice, Rheumatologist on Call, I evaluate many patients for a positive NA test, and together we do the diligent work to understand if the positive NA test comes from one of these 5 top reasons, from connective tissue diseases to autoimmune thyroiditis, liver diseases, infections, or even cancers. You can schedule your telemedicine visit from the comfort of your home. There's no need to wait, no need to spend time in waiting rooms or wasting your time in traffic. Until the next time, stay curious, stay healthy, and prioritize proper education.
Rheumatologistoncall.com